Minister, so we often hear complaints by locals in a town like Caledon about the kind of service that they receive at local public health facilities. What is your comment on that?
But what is their complaint?
The complaint is about poor service delivery, about bad human interaction or behavior.
Well, you might be aware that we have got a law that has been passed to establish something called universal health coverage, which we call NHI, where we share the resources equally. One of the biggest problems that we have in South Africa is that we've got two-track health systems. We've got one health system which has got all the money and all the resources and all the facilities, which is called private healthcare, which is served by medical aids. It covers only 14% of the population. On the other hand, we have got a huge public healthcare system that serves 86% of the population, but it is not well equipped because money in the country is found more in the 14% of the population, because these are well-to-do people. It's people who are running the country, who earn better salaries. They are the ones who are on medical aids and receiving the best quality healthcare, but they are only 14%. 86% are going to the areas we are talking about and complaining, but there's very little money going in that direction. And that is our gripe, that is our worry.
Minister, if people complain about the rudeness of hospital or clinic staff, how does the NHI solve that problem?
No. That rudeness is going to happen even during NHI. It happens in many parts of the world. That's why we've got structures to deal with that. One of them is the health umbad, which we put him in to resolve that some 15 years ago. I'm sure you heard the health umbad yesterday when he gave a report. The other structure is the Office of Health Standard Compliance. That wants to see hospital by hospital, clinic by clinic, whether there is compliance or not. The third are the professional structures which has been there for ages. The Health Professions Council, which used to be called Medical Council, that registered doctors and discipline them when they do things that you are mentioning. We've got the South African Nursing Council that does the same for nurses. We've got the South African Pharmacy Council that is the same for pharmacies. The reason I mention NHI is because of facilities. That some of the wrong things that happen in public health care is because of overcrowding, lack of staff, equipment, because money is going in one direction. That's why I was mentioning it. But about the behavior of people, no. The behavior of people will be regulated. Remember, health professionals, let me give you an example about doctors. They took an oath called the Hippocratic Oath. The nurses also took an oath or a nurse's pledge named after the first nurse, Florence Nightingale. All of them say, I won't do this, I won't do that, I won't do. But they are human beings. They still do them, whether in public or private. In public, it might be worse because that's where the majority of people go. But in private also it happens. That's why we've got all these structures. When we established the Office of Health Umbad, I was asked a question, what is a health umbad? Because there's never been a health umbad in South Africa before. I said it's a public protector of health. You know the Office of the Public Protector. When you think the state has given you a raw deal, you go to that office. Now in health, where you're supposed to go to, you needed somebody who understands health very deeply, who will know that this is not allowed, this cannot happen, etc. That's how we opened the Office of Health Umbad.
Minister, what is your message to those patients who are found to be sleeping on the floor of a provincial hospital, such as Caledon Hospital?
No, but that's exactly what I've mentioned to you. That we've submitted a list of 11 new hospitals which South Africa must build. The population is growing faster than our facilities. That's a fact. And I've said that many times.
I'm really asking if that is okay to you.
No, you know it can't be okay. How can it be okay? That's ridiculous, even to ask me if it's okay for me. How can it be okay for me? I am the Minister of Health. I want good quality health care for every person. That's why the definition of NHI or universal health coverage is that everyone is entitled to good quality health care. But when they access that good quality health care, they must not suffer financial hardships. So those things you are saying are not acceptable. But it's not that people do them deliberately, that somebody sleeps on the floor. That would be ridiculous. It's because of the shortages. That is why in the last year's budget, the Minister of Finance gave us 6.1 billion for the whole country last year. We sat down and decided what to do with it. One, we said let's hire 1,200 doctors. Two, we said let's hire 200 nurses. Three, we said let's hire 250 health workers. Four, we said let's buy linen, beds, a bassinet, mattresses, etc. And we are busy buying those things, as I'm saying, to the tune of 1.3 billion. It's because we want to solve problems like those. But as to the size of the hospital, that's why we submitted that dossier to the President and the Minister of Finance so that we build 11 new hospitals in the country. They are not the only ones, but these 11 we've submitted. The total we've planned was 17, but the 11 are the ones that we think are immediate.
Minister, do you have enough Afrikaans data to... No? Kan jy niks in Afrikaans nie?
No, niks.
Nee,
Ek kan nie Afrikaans lekker praat. No, ek kan net groet.
net groet. Okay, so groet die pasiënte van die Overberg.
Ja, ek sê van die pasiënte van Overberg, ons sal ons beste try.